Good morning, everybody. This is going to be one of my approximately 20 minutes. I'm shooting for 20 minutes. Critical thinking, the nursing process, and some tips on studying for nursing school. I hope it will be helpful to you. I left the objectives slide in today. We want to help you define critical thinking in nursing, talk about the steps of the nursing process, talk about how you can apply some critical thinking to your steps, and understand what evidence-based decision making is. So, what is critical thinking? If you look up the definition in a nursing book or in a dictionary, its definition says it's purposeful, goal-directed thinking used to make a decision to solve a problem. In nursing, it involves you collecting data from a person or a situation, analyzing it, and making a safe, effective care decision. So it has key traits to it in the questions. When you get questions on a test or questions from NCLEX or questions in a real life nursing scenario, you have to have an open mind, curiosity, and be persuasive. And you have to be able to try to make a decision for a patient. A lot of times when you walk in a room and you kind of walk in blind. And some of you already know this, but the people that make the national test NCLEX, which is given on a national level, although boards of nursing are regulated on a state level, the National Council Licensure Exam is a national test that all the states use. They updated a lot of their questions and they made them a little more heavy on critical thinking, not memory. Okay, there's always these memory questions that come up. You can memorize something, but you all learned in your high school. You learned to memorize things, but that's not what these questions are. They're having you make some sort of safe decision for a patient in a patient scenario. So, why is critical thinking important, particularly in nursing? The first thing is it ensures your patient safety. And I always don't just mean patients. This could be someone that you love that's in the hospital. I want to make sure that I use critical thinking so I get the best outcome for them on any decision that we make for their care during the day. If you go down, we need to improve our problem solving, and critical thinking will help us to do that. Sometimes they see a patient and he puts his call light on and the nurse goes in and she doesn't really solve the problem. She's busy or she's swamped. She's maybe got too many patients on her, to take care of today, and the problem doesn't get solved. And I think critical thinking on the nurse's part, the nurse, the RN, the LP, and the aide, anybody, care techs that takes care of them, if we can improve critical thinking, it would help problem solving for the patient and even for our units that we work on when things come up. So the green button says supports evidence-based practice. So what's evidence-based practice? Well, most nurses don't follow evidence-based practice, but it would help them in their critical thinking and their patient outcomes. And the only example that I can think of at the top of my head, it's kind of early in the morning here and I'm still drinking my coffee, would be the Foley catheter insertion technique. And the Foley catheter insertion technique for years and years and years involved taking the syringe after you get your sterile field set up, and you would go and you would test the balloon in the Foley before you inserted it into the patient. And the rationale that I was given when I was a young nurse was that we were testing the balloon to make sure that it worked. So if you fast forward 38 years, we now have something called healthcare acquired infections that people actually get an infection in the hospital. One of the biggest causes is coming from Foley catheters. And when the heavy research started, the evidence-based practice started looking into why patients were getting so many healthcare acquired infections. One of the things that came up was when you try to pre-inflate the balloon on the Foley before you insert it, and that is causing irritation in the urethra, which is contributing to some of the UTIs. And so I support that evidence-based practice. I no longer tell you as a student to pre-inflate the balloon. I no longer do it when I put in a Foley, but sometimes I'm out and I've been able to put in a Foley catheter with one of you students. I'm there to be your coach and your support person. And when we don't inflate the balloon, I had some nurses call me out on it and say, you didn't have that student test the balloon before you put the Foley in. I said that is no longer evidence-based practice. I do not want this person to contribute to any healthcare acquired infections for this patient. And when I tell the nurse working on the floor that the evidence has been around for a while backing up to not inflate the balloon, some of them look at me like I'm crazy, which I probably am, but that's a story for another day. We can talk about that at school. So that's one example. There's tons of other examples, though, I could probably think of and give you. So we'll talk about those in class. The light blue button says enhances teamwork and communication. Don't you think if people were better critical thinkers, we wouldn't have to I don't know about you. I work in a predominantly female profession. I like when I work with guys because they're more straightforward. But sometimes I just think if we had better critical thinking, we'd all get along a little bit better and the teamwork would go just a little bit better when we do our care on a day-to-day basis. So I want to give you some examples of some questions because a lot of you come to me and say, what can I do to pass? I'm not passing. I don't know why I'm not passing. And oh, I just put hours into my studying. First of all, I don't believe you. You probably got distracted a lot with family life while you were studying. Now, some of you are trying to cram and some of you are not using AI properly, but I'm going to chat about that a little bit here too. But here's a practice question. This is a nursing question without a lot of critical thinking. What is the normal range for adult respirations? It's 12 to 20. I believe in your textbook, and that would mean, if you would check my respirations when you do an assessment, you would want it to be between that range. And that's just something that you can memorize. If you had 4 options, you would be able to pick out which was the normal one in the option. It doesn't require any depth. It's a memory question. And occasionally there are some things you have to memorize in nursing, like a normal potassium level is 3.5 to 5. I know what the normal respirations are, but they're not going to ask you a question like that. They're always going to ask you questions now that require you to analyze something. I'm going to give you an example of that in the next slide. Here's a question about respiratory that requires a little bit more critical thinking. So the question says, a nurse is assessing a post-operative patient who is receiving opioid analgesics. Opioid analgesics are narcotics, for those of you that are in fundamentals and don't know. And they're given for pain control. Which respiratory findings should be reported to a healthcare provider immediately? And I do have some issues with this question, but we're going to go over it and over the answers. And listen to me, stop trying to grab an answer that you memorize. You're going to have to look at all 4 options to decide which one is the best. And that means you're going to have to slow down when you're test taking. Some of you are trying to go through and do 85 questions in 15 minutes. Well, that's how I operate, Miss Y. Well, that's how I operate. That's how you're failing the test. You're not reading it. Okay. So we know I always reread it back to myself. I've got a post-operative patient and he's in some pain and I went in to assess him and something's going to be wrong in one of these answers. So A, he has a respiratory rate of 16 breaths per minute with a regular rhythm. Well, I do know memory that the normal respiration is 12 to 20, so that's probably not my answer. B, oxygen saturation of 90% on room air. Some of you don't know what that is. That's that little thing that they put on your finger to check your oxygen saturation and make sure that you are 90 or above. So it's not B. But when I go to C, it has some flags in it that tells me that could be the problem, but it's a critical thinking problem. C, respiratory rate of 8 breaths per minute with shallow breathing. Shallow breathing is someone who's having trouble breathing. Okay? And respiratory rate of 8 is below 12. And I also know that this person had narcotics, which is another thing you have to learn about. And the narcotics will make your respiration slow, and you have to watch people after you give them narcotics. A lot of times they need oxygen post-operatively. So that's right now. That is my tentative possible answer. I'm going to do D. Patient reports mild shortness of breath after ambulation, which is very common after surgery. They tell you they're a little winded. That's not something that I would feel that needed immediate attention other than to have a patient sit down. So the answer is going to be C, but you see, it is kind of have memory things in it, but it's kind of about people. People are holistic. This patient after surgery, he's in pain, he's at risk for falls. And sometimes students say, I need you to tell me what chapters are on the test. It's kind of all of them, guys. It's all of them. It's everything. It could be this guy's at safety risk. He has a respiratory problem. We're having a problem with the medications. If he's on narcotics, we may need to lower the dose a little bit. And I definitely think he's going to need some oxygen with a respiratory rate of 8. And he needs to be seen by a physician. So this is critical thinking. It involves multiple things that you kind of have to put together. And when you're trying to study the night before or study something that you made on AI, some type of study guide, you're not going to understand the test when you take it, the test question. Okay, I want to talk a little bit about a couple of items. The first one would be study guides. I know that there are some schools that I am being told that still give study guides in nursing school. I am currently working in an environment, I am gearing this PowerPoint to those students that you don't get a study guide. Trust me, you don't want one. Okay? And let me tell you why. Because when you go to take this national license NCLEX test, those questions aren't study guide questions. They're going to have you have a patient scenario where the patient's in some kind of danger and you have to make the best decision for them. And the study guide will not help you. It appears to help you in the short term, or you kind of, and if you were at another school and you're coming to see me and I don't give you a study guide, I know you might be mad, but there's a reason. I want you to be able to tell me concepts. Okay. I want you to be able to teach back something that we talked about in class. For instance, if I do talk about potassium, which is a major electrolyte in the body, and you learn the normal range is 3.5 to 5, you also need to know what happens if it's too high or it's too low. And we don't give it IV, and how we give it through an IV. The RNs give it through the IV, the LPNs don't. But you also need to know what kind of signs and symptoms I might be having on an EKG if that potassium is not in a normal range. So it isn't something that I can give you on a study guide. It's something you have to be able to teach back to someone else. So what I'm recommending to you is make a list of topics that you know we've talked about. If we're in class and you want to kind of put that together, that never bothers me. If you have one of those, a lot of you have iPads, and I know you have to bring your own computers. Write them down, or if you do want to go to and you write them down, and then make sure that you can tell someone in your family and teach back to someone the information, okay? As if I was a patient and you came to me and I says, well, I don't understand why you're giving me potassium. Is something wrong? And you would say, well, occasionally after you're sick, the potassium can get a little irregular. We're going to give you a little bit in your IV, and you're going to explain that to me. And there's also medications that lower your potassium where you have to take potassium. You have to kind of teach a patient. We do a lot of teaching in nursing, so you have to be able to teach the information that we learn in class, okay? And that will help you the most to be able to teach it back to someone. And that's how we teach patients. If a patient needs to learn how to give insulin, I go and I demo it, and then I have them try to draw it up to see that they know how. That's how we know that a person knows this type of information. All right. The other thing I want to talk about is AI. AI is artificial intelligence. I believe that I have an Alexa in here in my kitchen that plays music and tells me the weather. My son, our son got it for us, and we also have, Siri on the phone. But there's AI online now. I believe the big one that I hear, or that I went in to look to see how to use, is called ChatGPT. I had quite a few of you over the past term come to me for tutoring and were struggling, and people said to me, oh, well, I didn't do anything in the books that you gave me or any of the online modules or practice questions. I just made a study guide at this ChatGPT thing, or some other site. There was one called Claude, and I studied that study guide. You're still doing it wrong, because here's the thing. If you never touched the book or the modules or the practice questions, you never knew the material to start with. So what I'm recommending, if you are using AI, I'm not against it. I've been trying to use it to help me get my notes organized. It's very good for that. And even practice questions that I can give you in class that aren't going to break any laws or anything. But the truth of the matter is, if you're going to do it, if you're going to make something there, go and take notes on their study guide and see how accurate they are. Don't assume that they're the catch-all. It seems like, well, that's AI. It knows. No, it makes more mistakes than anything I've ever seen. And we now are able to put your material in and see that you copied it out of there. I have a project in the fundamentals group, and most of the students just copied. It told me that the program I put it through. I don't want you copying off of AI. I want you to learn the material, okay? I know I get it. It's easy, and nursing school is a lot of work, but you're not helping yourself when you're doing this, and you're going to have to plan, because I know you've got families, and I know what happens at my family here. I won't be surprised my husband's up getting a shower if he doesn't come down while I'm talking to you right now and ask me, do you know where my car keys are? So it's always an interruption when you're trying to do something, and that's just the way life is. It's just something that goes on. And those are the children. I know the school calls all the time, and inevitably they're going to get sick on the night before you have clinical. Just kind of plan on those kind of interruptions, that there's going to be quite a few rocks in the road. And like I said, I don't mind AI. I think you're going to find it is a little helpful. Maybe use it for practice questions for you. Have it teach the AI. Okay, work on have it ask you a question on whatever topic that you're struggling with. I had another student who was having trouble in pharm, and she said no one in my family is available to teach back. She recorded it into her phone and then played it back. And I thought that was this person was just absolute genius to come up with that idea. I thought it was a great idea. So, and think about this when you go to study this term. So this is specifically from me to my students, but as some of the rest of you that maybe aren't one of my students can take this and think about this. There are some best practice ideas that are currently being used, and that would be that your assignments are due before class. Okay, that means that you got to read the material before you come to class. That is entirely different than what you've been used to doing, and it's hard to get used to. Everything's online now. These modules are great, and they also come with a book. You can read the book and go on and do the practice questions that are given to you. I usually personally give you a voiceover, just like I'm doing right now, a short lecture about. I'm trying to cut these PowerPoints down where I'm not reading them to you. I'm trying to explain things to you because class time's kind of short for some of you. I don't have time to cover everything, and I do like to cover topics with you before you get tested on them. But they are sometimes concepts, and you need to think about that. Listen to the voiceover ahead of time to kind of prep. And if you go and you say, well, I've had some of you tell me I don't like to read. You are in nursing school, guys. You're going to have to figure out how to get this content and understand it. I don't blame you. I hate sitting here hours and hours with a book. I'm probably why I'm in nursing. I like to do hands-on things, but that you still have to work on the content. All right, and you need to do that before you come to class. Okay, we're going to do a quick overview of the nursing process, which I need everyone to memorize the steps, but I also need you to understand them. So I'm going to go through them and give you a couple of examples in your real life and in your nursing day that you actually do this all the time. This is just writing out what you're actually doing. So what is the nursing process? A systematic patient-centered framework to give nursing care. It actually has 5 steps. The first step is assessment. The second step is analyze or diagnose. Third step, planning. 4, implement. Implement means to do something. You're actually going to do an action. And 5, evaluate. Okay, this is continuous. You are doing this all the time. The way I learned to memorize this was ADPI, the D, making the D number 2 for ADPI to memorize that. That helps you to memorize these 5 steps. I'm going to go over the steps so you understand them rather than just memorize them. So let's talk about the first step in the nursing process. It is what nurses predominantly do. We assess things, okay? And you collect subjective and objective data, okay? We collect data by observation, interview, doing a physical exam with our stethoscope, getting a health history from a patient, and we use critical thinking to identify what's going on. So I need you to memorize what subjective data is and be able to give examples. And subjective data is how somebody feels. It's something that I can't prove. So I'm having pain in my left hip. I'm nauseated. I don't sleep well. All subjective data. Objective data is data that I can have you verify with me. And for example, a blood pressure, a temperature, a glucose, anything that I can that is hard data like that, that is objective data. I can have you go in and verify a glucose on the glucometer. If I got a 52 and you go and say yes, he's 52, then that we can verify that. Anything anybody feels is subjective. Anything that we can verify is objective. And a lot of times they ask you for an assessment in a question and you answer some other answer. You're looking for something that it says, what other further assessment is needed? Then one of the answers needs to be assessment. Okay, and so keep that in mind, that that's about subjective and objective data. So step 2 of the nursing process is either diagnose or the word analyze. Okay, so we're trying to figure out what needs done. If you go to the room door of a patient's room and say, your call light is on, can you tell me what you need? He gives you data and then you decide what needs done. That's diagnose and analyzing the situation. If you go into your doctor, and you know how you go into the doctor and they say, tell us what brought you in today. And maybe you say, I have a sinus infection, and you start telling him how stuff's dripping down your throat and you're sneezing and coughing, and you know that antibiotics don't help a virus, but you think maybe it's turned into something that needs antibiotics. He's diagnosing and analyzing the information you give them. So this is just what we commonly do in healthcare. This is the way this is taken care of. And I'm going to give you a couple examples over here in real life. So we're taking the data, the subjective and objective data that we get, and we're either analyzing, diagnosing what needs to be done. Okay, what kind of health problems are going on? So step 3 of the nursing process is planning. I always say that I'm making a goal. Sometimes it's a quick goal I have to make. Sometimes it's a long-term goal. It needs to be specific and measurable, and I have to use critical thinking. I have to be planning on doing something that's going to solve the problem and be with good scientific basis. This word, step 4, implementation, sometimes it's a big vocabulary word for some of the newer students, but basically it means, what am I going to do? I'm going to carry out the nursing intervention that I plan quickly in my head. It might be direct or indirect care, and I'm going to use critical thinking when I do this. Step 5, evaluation. I'm assessing the patient to see did he respond to whatever I did for him. If I gave him a pain pill, I check back half an hour later and see where his pain is. If I gave him glucose for low blood sugar, I'm going to stay with him until their blood sugar is in a range that's acceptable. In critical thinking, I may need to modify what I did for a person during this evaluation step. So this is really kind of involved kind of a thing, but it's not. We're going to break it down a little bit more on the next slide. I wrote out this real life nursing example, this example of the nursing process that has nothing to do with nursing, but it's kind of a thing that you do all the time and you don't even realize that you use these steps. So I'm going to give you my assessment data. It's objective mostly. My low gas light came on driving home from Medina the other day. The low gas light tells me what? I'm getting low on gas, and you guys know I drive. It's probably about an hour to get out to the clinical site for me. And my car actually sputtered and had a kind of a weird sound when I turned a corner, like it was getting low on fuel. And I was heading up a hill. I do know that I got paid today, and I did see gas. Well, at the one place was 346, which I thought was a little high. Gas has been up, but I can fill up since I got paid. I do have some subjective. I feel like I have some time. I want to fill it up for the rest of the week. That was how I felt about it. And so that was my assessment part of this. So I'm going to diagnose, my diagnosis and analysis is that I need gas, and according to the data, I need fuel in my car. Okay, so my plan, I make a plan to stop at the station on Route 224. I am over on the east side of Akron, and those of you that know where Route 224 is. I implemented my plan. I pulled into the station, I filled the tank up successfully, got my receipt. I evaluated the situation when I got back in the car. My car was running well and the low fuel light went off. That's the nursing process. You do this all the time. You maybe even do it when you send your kids and say, do they want to buy lunch today? You take the data, what's for lunch today? Do they want to buy or not? And you do, this is just your common thought process that you do day to day. I used this nursing process with a client. This was actually a family member. But I'm just trying to show you that you don't just do this nursing process when you're at work. You do this at home too. My assessment data starts out subjective. A child woke me up and said, I don't feel well. When I looked at him, I know some things objectively about him. An insulin-dependent diabetic, showing me that the blood sugar is 52 on his glucose meter. That's objective. I can see him sweating. I can see his hand shaking. So then I have to go and I have to make a decision here. What's going on? Okay, this person has a low blood sugar and I have to make a quick plan. A quick plan for someone with a low blood sugar is to get them some sugar. Some examples of sugar that can be used are orange juice. Milk actually works. White bread works wonderful because white bread is nothing but pure sugar. I go ahead and I do the implementation. You feed the diabetic person, and then you're going to evaluate, did the blood sugar come up in these signs and symptoms. These are called signs and symptoms, by the way, guys. These subjective and objective things are signs and symptoms is the other name for those. Signs and symptoms of something. You're going to go ahead and you're going to treat that person and you're going to stay with them. And you do this also with patients at the hospital. If you're in a healthcare setting, this is how you would treat a low blood sugar. We always treat a low blood sugar. We always believe the patient, even though they could be wrong, and that's not what their blood sugar is. We start planning to treat them. We don't want anybody to have a seizure from a low blood sugar, okay? So keep that in mind, but this is a way you would use the nursing process with a client. So here I actually wrote out the nursing process for this patient that we're talking about. Analysis or diagnosis. What do you think's wrong when you first started talking about the patient? Did you realize it was low blood sugar? And what's the immediate plan needs to be? And plan, I need immediate glucose. This isn't a long-term plan here. This is sometimes patients goes, I want to get up and get my bath. That's a longer term plan. I've got some time on this, but this nursing process here, I've got to go kind of quickly. So I give the glucose an intervention. My intervention, I give some orange juice. We know there's other options, and then I'm going to stay with that patient, evaluate them until their blood sugar's in the normal range, and they're no longer diaphoretic, and they state that they feel better. To finish up a little bit here, I did run a little bit over my planned 20 minutes. We're going to be around 24 minutes, but I do think there's a lot of barriers to critical thinking, lack of knowledge, time constraints for people, personal bias. They say that sometimes you get biased against people. I've had nurses where I've had somebody who kind of looked like a big biker dude, and the nurses say, oh, he's just drug seeking. I'm like, he just lost like his leg in an accident. I don't know that he's drug seeking right now, but that's a personal bias they have that because the guy is a Harley rider that he must be a drug seeker. That's a bias. That's not really true. So that's definitely something that people have a problem with. The other thing is just poor communication. We don't use therapeutic communication effectively in healthcare. People are tired, they came from home, they had to get the kids on the bus or whatever, and they don't use that therapeutic communication effectively when they're in their healthcare position. Thanks for listening today.